quickly introduce herself before Rebecca gets going.
Hi, thank you all for being here. I'm also Tori. I am Tori. I also use she, her pronouns. For an image description, I am a white woman with red hair, wearing black glasses, sitting in front of a blue painting and two black bookcases. And I'm also disabled and a volunteer with Rebecca. And we will go ahead and give Rebecca the floor.
Hi, I'm Rebecca. I'm a white woman wearing glasses, standing in front of two black bookshelves with some fun Christmas lights on them and a solidarity sign, a dachshund statue, tells you a little bit about what I'm into, and I'm so humbled to be here with all of you today. Thank you so much for registering to just hear from me about our disability justice and accessibility platform. This is something that was so personal for me to put together. What really put me on the course to run for office was a day in 2013 that completely changed my life. Up until that day, December 7th, 2013, I was guilty of what honestly every able-bodied person is. I didn't think about access. I didn't think about inclusion. My mother's disabled, and so I saw her experiences. I supported her needs for healthcare, but I didn't have that day-to-day struggle. And that day on the 6 train, I was pushed and my leg was crushed in the gap between the train and the platform. And that started a long journey for me where I have a lifelong disability. I have a degenerative condition with my left leg. You don't see it now, but when I'm out in the community, when I'm campaigning, when I'm going to the supermarket, walking my dog, I have a cane. I have a mobility aid because by the end of the day, I'm not moving so well. Stairs are difficult for me to do. And I've had my own very personal experiences of discrimination and neglect and feeling unseen. And even now speaking about it, it makes me want to get emotional, honestly, because there are those moments and that's what made me want to fight. The big one that comes to mind is when I was at City Hall. I work for a labor union. I'm a proud union member myself. That's the solidarity sign over my shoulder right now on the bookshelf. And I was there representing union workers in my professional capacity. And to get into City Hall, there's a very large flight of stairs up. And I had just come back to working day to day, and I wasn't able to do the stairs. And I looked at the sergeant of arms and I said, "Excuse me, how can I get into the building? I can't do these stairs. As you see, I have an issue. I was in a subway accident. Please help." And their response was that if I can't walk up the stairs, then I shouldn't be there, perhaps. And that was the day that I chose to fight for everyone, not just for myself, but for all of us. Because if that's what I, as a white woman with a job that takes me down to City Hall, knowing where the levers of power are, if that's how I'm going to be treated, how are others being treated? Who's speaking up for them? Who's listening to their needs? Who's fighting for them? And I was fighting for myself, but like I said, it made me want to fight for everyone in a very different way. And that's what put me on the path to running for office right now, because New York City doesn't really have any representation from disabled New Yorkers in government. And that's why we don't have accessible transportation. We don't have the services we need in our schools. We don't have housing that's fully accessible. For example, right now, I'm zooming in for my inaccessible living situation. I live in a walk-up apartment building. At some point, I won't physically be able to do these stairs anymore to get to my apartment. But is there the affordable housing that I need, that disabled New Yorkers need, to be able to call home, to be able to afford, quite honestly? And so with all of these personal experiences, I threw my hat in the race for New York City Council here in Manhattan's 5th District. It covers parts of Midtown East, the Upper East Side, East Harlem, and all of Roosevelt Island, which if you haven't been to Roosevelt Island, it's a beautiful little gem. There's an amazing park there called Four Freedoms Park. It's dedicated to Franklin Delano Roosevelt, and it's actually getting a disability justice statue in that park. And I'm so looking forward to going there and seeing it and being able to celebrate that, because having that representation in the community, I love. And it shows how committed people are here and how much we can really do with the issue locally. And so with that, I spent a few months working on our policy platform. As I said, it was very, very personal to me. So I didn't want to rush through it. I didn't want to just have a few bullet points, touch on a few areas, say, oh, we need funding. No, we need to take things to another layer. We need to be pushing the envelope in a much more comprehensive, intersectional way, because in the sign-in room when we were all chatting, I said one of the big words I use all the time is intersectionality, and that's really what this platform is to me. As you see, it touches on areas starting with COVID-19, ending with small businesses, on housing, transportation, healthcare, financial security, where actually in the waiting room before we all came in here, a wonderful gentleman and his wife, Emily, Kip was the gentleman's name. They brought ideas to me already for how we can make this platform even better and continue building it and growing it. Because this platform, while yes, it may be comprehensive to start in some areas, this is not everything. By no means is this everything. This is a starting point. I want this to begin a conversation for all of us here in New York City. And then with myself as council member, we come together as a disability community. We come together as disabled New Yorkers, with advocates, with organizers, with my neighbors that have their own profound personal experiences, to decide, what policies do we move on first? What is the absolute big thing we have to move on first? What bill are we introducing? What policy? Are we going up to Albany to the state legislature? Are we going to DC to work with our federal elected officials? Because this is a collaborative process for me. To put this policy together, I need to thank some special people. This was reviewed by advocates and organizers from across the entire country, people with a range of their own disabilities and lived experiences, because as I said, I have my own lived experience, and that's a very small subset of what so many others live with and experience day to day. And I want to be sure we are always centering the needs of people from different backgrounds, different experiences, because having my voice there alone is not enough. We need to all sing together in a chorus so loud so they hear us together, because when we fight together, we win together. And that's what this is about. So for some special shout outs, I already thanked Sarah and Tori in the sign-in room, but again, Sarah and Tori for moderating tonight, for helping with the platform and just doing so much amazing organizing work around this. I need to thank John Korn, Kat Bolton, Jules Good, Cale Hill, Greg Baratan, the entire Crypt the Vote team. I need to thank the 504 Democratic Club here in New York City that shared the platform with their membership, and it brought ideas to me. There were changes to my accessoride policy from them sharing this with their membership, because that's who I am. I'm collaborative. I don't know everything. I won't ever pretend to, because you can't as a human. And that's why we're all here together tonight to speak about the platform. I'll answer some questions, and then at the end, we'll open it up. And if you have a question, if you have an idea for something that's not on the platform, something that we can be doing differently, doing better, adding to it, removing from it, I am 100% open. Don't be shy. Don't be afraid. There are no bad ideas and there are no wrong answers. So with that, I will dive into a little bit about the platform. If we went bullet point by bullet point, we would all be here all night on a bi-coastal timeline. So I will try and be succinct as I can, but I really would love to run through it with all of you, give you where my mind was at when it was being created and the policy points that we're hitting. And we're going to start with the biggest thing affecting all of us throughout the country right now, COVID-19. And that's about vaccines, that's about nursing home accountability, and that's also about empowering disabled New Yorkers to be able to stay in their homes and not be forced to go to a care facility because they can't have a loved one take care of them at home. There isn't the funding support for it. There aren't the social services. There isn't the healthcare support for it. So for me,
Rebecca Lamorte, R4, select R4, inbox, R4, date time, March 15. Please page internet.
Thank you. So for COVID-19, we start by expanding access to vaccines. Today, California opened up their vaccines to disabled Californians, so that was so great. Congratulations to people on the Zoom now that got that dose. It feels so great, doesn't it? It's a relief. And it's, I got my first dose of Pfizer and I thanked everyone, literally everyone walking out of the Javits Center here in New York when I got it, because it's been such a long road for all of us. But here in New York, It's still a very long road for so many disabled New Yorkers because the slow phase in for eligibility, it's leaving so many people on the sidelines. Also, the slow rollout of vaccinations at home. They're starting with homebound seniors now and disabled New Yorkers, but it took so long. So many people could have been vaccinated at home sooner and protected much quicker. Because when you think about if you're at home and you need medical care, but you're not vaccinated and you're concerned about going out with COVID, that keeps you from getting the care you need in so many different ways. And for nursing homes, I touched on it a little bit in the waiting room, but here in the community, we have Kohler Hospital. It's a nursing home, it's a rehabilitation center. And during COVID, residents there have not been allowed outside, physically outside. They haven't been able to see loved ones for a year. Think about that toll that it takes on your mental and your physical health. For all of us here right now, we've experienced changes to our physical and mental health because of COVID, but it's even more so exacerbated on the inside of these facilities. And here in New York, now learning that Governor Cuomo withheld information, lied to the public, was disingenuous in what was happening in nursing homes, it makes it so much worse. So this platform focuses on expediting vaccines, increasing accountability for people that were in charge of nursing homes during this time, working with the governor's staff, working with state government to withhold information. Those people need to be held accountable. People weren't able to see their loved ones. Loved ones lost family members inside and they did not know. And they're only now learning about the true impact that COVID has. And people need to be held responsible, fully responsible, because we can't get those lives back and we can't get this time back. And accountability for me is key in every aspect of this platform. Now shifting from COVID-19 onto transportation. I will be honest, transportation was the first thing for me as a disabled New Yorker that drove me up a wall. The anger I feel right now towards the MTA is difficult to put into words because less than 25% of the entire public transit system here in New York City is accessible. There are over 1 million disabled New Yorkers, and that just counts disabled adults. We're not even thinking about children under the age of 18. So imagine how large that this issue is for so many New Yorkers that just can't get on a subway. I spoke earlier in the waiting room about partial accessibility not being accessibility. How earlier today I was at a union rally coming home, trying to get on the Q train. That stop only had an elevator to take me down to one level, not all the way down to the sub levels of the station. What do you do if you're a disabled New Yorker? You get there, you think it's a fully accessible stop because the subway map says it is, and then it isn't. What do you do? Where do you go? And because we don't have representation in government, because no one is speaking up and speaking out and fighting back, the MTA has been allowed to eliminate accessibility upgrades. They put forth a robust billion-dollar plan, and elected officials sitting in office right now said, why are we spending money on that? Why is that worth the cost? People say to me, Rebecca, it's too expensive to do. And when I hear that, I hear my life isn't worth it. I hear my neighbor's life isn't worth it. I hear your lives aren't worth it. And I'm here to say all of our lives are worth it, that we need access to every area, physical access to the subway system, to buses, because that's also another thing. The MTA will say, well, just take a bus. Oh, just take a bus. My New Yorkers here on the Zoom, you know what it's like when that packed bus rolls up and you can't get a seat. People won't get up for you to get your wheelchair on. When the bus is so packed, you have to wait for the next one. You're waiting long periods because now here in our community, they're cutting our bus lines. They're cutting our service. So what do? That's not a solution. A solution to inaccessibility is not pushing the problem off in another area. It's solving that problem for me. So we need to have our public transit system be fully accessible. Every single stop, elevators, escalators, ASL support for vision and look for low vision and blind New Yorkers. We need to be layering accessibility that isn't just physical access to the space, but it's full support services. Because even think about Metro card machines. They're not always accessible. How do you get a Metro card if you're not able to physically use that screen and access it? How are you, if it happens to be an accessible stop, how are you then getting what you need to get on the train? So accessibility within our public transit system is paramount to me. After that, I would say another one of the largest things are disabled parking permits. Here in New York, you can get a parking permit. It's very difficult to do. It's an arduous process. It requires me going to a number of doctors to get approval to apply for said permit. And for so many people, that arduous task, it's so difficult. And then after that, New Yorkers on the call, good luck finding parking then. You're circling, looking for street parking, and you're out of luck most often. You're spending a long time parking because we don't have dedicated spots for these permits to go to. We don't have any system in place for that. So we need to expand parking permits. We need to expand street parking specifically for New Yorkers with these permits. And we also need to break away from the conversation that having a placard to use for your car if you're a disabled New Yorker is nowhere akin to the placard abuse that happens in other areas. I'm sure many of us here are familiar where you see a car parked in front of a hydrant and they have a little doctor's note on it, and what are they doing? That's placard abuse. Why are you parking here? You shouldn't be there. And many times people try and conflate the two between the permits and the placard abuse. And all the time at my community board here in Manhattan, I'm saying, no, they are completely separate issues. We cannot banning car culture, as they say, that affects disabled New Yorkers in a very negative way. We need to be incentivizing public transit, but also offering the parking support and the street support and the vehicular support that's needed. And that also then takes us to Access-a-Ride. So Access-a-Ride, it is a deeply flawed system, but the city implemented a great process as to start having Access-a-Ride cost no more than the swipe of a Metro card. That was really great, but then they did away with it. And so now you're faced with long wait times. Sometimes rides will be canceled. A woman in the neighborhood that would come to a local Black Lives Matter protest, she would complain all the time. I want to be here at 7. I'm showing up 30 minutes late. I was on time, but Access-a-Ride wasn't. I'm so sorry. And it's not for her to apologize about. I would always say, Elizabeth, no, that's not you. That's the system. We need to fund the system. We need to expand the system. And also we need to be sure that no ride is more than half the fare of a Metro card, because that then gets us to an intersectionality issue where disabled New Yorkers most live at or below the poverty line. So many people are struggling financially. So now to have the cost be higher, we can't be doing that. We need to be sure that we have the mechanisms in place, the funding in place, and also the support for the agency in place to expand service, to eliminate the wait times, have a larger fleet, and again, be sure that it's affordable to New Yorkers, because we cannot be moving forward on anything that's supposed to promote accessibility for those that can't use our public transit system, but then it's inaccessible in a different way financially. Now to pivot to our streetscape. So for me, streetscape is a few things. How we do storm response. Here in the neighborhood, I started snow cleanups, and I said, snow removal is an accessibility issue. And people looked at me like I was crazy. And I said, it is. Snow removal is an accessibility issue. We cannot have our sidewalks covered. We cannot have our curb cuts covered in ice. We cannot have the few accessible subway entrances blocked. We need to be really moving this snow, this ice in a very quick manner. And there's no plan at the city level for this right now whatsoever, because the workforce that would do that is also the people driving the plows, moving it off our streets. And so New York City needs to engage in a robust plan for storm preparedness, for quick removal of snow and other storm issues like flooding, for example. Our roadways are old, our sewers are not ideal. And so flooding impacts disabled New Yorkers as well. Also the physical streetscape. I need to shout out John Korn for this one specifically, how we need to repave our sidewalks because cracks, divots, holes, raises in the sidewalk. If you're a wheelchair user, if you're someone like myself with a cane, if you're using a walker, or heck, if you're a parent pushing a stroller, having that smooth sidewalk is the safest way for you to get around the community. And again, that pivots us back to the intersectionality of the platform, because we could have good jobs, good union jobs for New Yorkers to do this infrastructure work, especially now with COVID, where we know the economic impact it's having on so many people, that we can put people to work and enforce strong accessibility and an equitable streetscape for all New Yorkers. Now moving on, one final thing also I will say, so I know I'm speaking a lot, but another thing in the transportation section that's also very important to me is the removal of benches from our subway stations, and also the lack of benches and bus shelters for bus stops. That's an accessibility issue. It's the city removes them because they don't want our unhoused neighbors sleeping on them, which is a reprehensible issue that we could speak about also very long term. But it affects disabled New Yorkers as well. Today, when I was waiting for the queue, thankfully it was only a 3-minute wait, but if it had been longer, I need a seat. I need to sit down. That specific station, I actually reached out to the MTA about after the benches were removed about 2 years ago. And I said, hey, what happened? Why did you remove the seating? And they never even got back to me. Never got back to me. So that's the lack of care. That's the lack of oversight for this issue. And that's their lack of awareness, because they're trying to be heinous individuals and keep unhoused New Yorkers from having a place to sleep at night. But they're also keeping disabled New Yorkers that struggle to access the system, if they're even able to, now from having a comfortable seat and a comfortable way to wait for the train or wait for the bus. So ensuring that we have adequate seating and adequate support in that area in our public transit is also something that's very important. Now pivoting to employment. So I come from the labor background, solidarity once again. So for me, being sure that we're empowering disabled New Yorkers by ending the sub-minimum wage, which as recently in 2019, there was legislation in the New York State legislature that was voted down. I'll say that again. It was voted down to end the sub-minimum wage for disabled New Yorkers. So disabled New Yorkers right now can be paid as little as a few cents on the dollar for working. And that is modern day servitude. That is modern day slavery, just like the carceral system with unpaid work there. This is a part of that as well. We need to be ending the sub-minimum wage. Every single worker, no matter where you're at, what facility you're in, you need to be making at least $15 an hour. And as council member, I wouldn't be able to work on that specifically. It is, as people joke, an Albany issue. But I will work and I will organize with our elected officials here in the community to introduce legislation in the Assembly and Senate and be sure that we are ending the sub-minimum wage. It's something that President Biden was trying to do through his federal $15 an hour. Unfortunately, that didn't happen. And there's so many other things wrapped up in that as well that are unfortunate that we didn't see that bill pass, but that would have been groundbreaking for disabled Americans because it would have eliminated the sub-minimum wage throughout the entire country. But we can still fight here in New York while that's not happening federally. And I, with my bully pulpit of state elected officials, my strong organizing background, we will make it a reality and we will end the sub-minimum wage here in New York. Also outside of that, increasing employment opportunities. New York City has some great programs like Create NYC, which helps match disabled New Yorkers up with careers in the arts and cultural aspects of the city, which we have so many museums and theaters and institutions, but we need to expand that program so more New Yorkers can get access to these jobs and be put on payroll and internships and just really revolutionize Create NYC and the opportunities it offers. Also, another great piece of legislation is the ABLE Act, which does financial literacy for disabled New Yorkers. So many disabled New Yorkers rely on Medicare, Medicaid, Social Security, disability insurance, and other benefits. But if you quote unquote make too much money, which also includes if, say, you get married, unfortunately, you are at risk of losing those benefits. And that's something that we also need to be working on. We need to be empowering disabled New Yorkers with financial literacy, letting them know ways that they can save that will not be putting any of their benefits at risk. And the ABLE Act does that. For this one, it's about increasing education, putting more staff support behind it to do the outreach to disabled New Yorkers to let them know this is what you can do, this is where you can save, let's set up this account, this is what we can do, just to be sure that we're really enforcing strong financial support and strong financial independence for disabled New Yorkers. And another thing that also intersects with COVID, again, it's my big word, intersectionality. If anyone's playing bingo, let me know if you've won tonight when I say intersectionality 5 times. But implementing flexible work schedules and flexible work environments. This is something that disabled Americans have been pushing for throughout the entire country for a long time. And COVID made it a reality. We're working remotely. Employers see now that people can be working at home, they can have flexible schedules, and work still gets done. But now, as we see vaccinations more robustly rolled out, people will be going back to work. None of this is codified in law. Disabled New Yorkers that finally had the access that they needed to be able to work in a way that's comfortable to them, be it remote, be it flexible scheduling, whatever, that's going to be eliminated. There's nothing to protect that. And here at the city, it will take a long time to legislate legislate, but we can start by introducing legislation on that. And while we're waiting for that bill to pass, with myself as council member and the #1 person out there pushing it like a dog with a bone, for a reference for my dog Forrest, who's over there looking cute, is that we can start with the city agency workers. So the city employs so many people, and we have the power to put forth policies there that don't need legislation to change that. So we can start a pilot program for flexible scheduling, for remote work, for city workers at city agencies, every level of government, and then we can build that out and implement it with the private market while passing that legislation, like I said. So we can start at the city level, we can see what works, we can see what doesn't work, we can see areas where more education, honestly, has to be done for employers so they understand the importance. Because like I said earlier, able-bodied people are guilty of not thinking about this until it personally impacts them or someone brings it to them directly. And so I will be here to bring it to them directly so they can't pretend they don't know about the importance of flexible scheduling and remote work. Now on to healthcare, which healthcare is a very difficult one. So I spent a lot of time reading and brainstorming on healthcare because so many of these issues are federal. And to think, okay, how can we get a bite at that apple and get the support we need for disability justice here at the city level? And it starts by ensuring that local hospitals continue taking Medicare and Medicaid. And let me break that down. So here in the 5th District, we have what's called Hospital Alley. You have Cornell, you have Presbyterian, you have Mount Sinai, you have these NYU Langone, you have these large conglomerate hospital networks, but they're private. And now they're stopping taking forms of Medicare and Medicaid. So seniors are being disenfranchised, disabled New Yorkers are being disenfranchised. They're being forced to travel more to get to hospitals that take their plans. And again, intersectional, let me know if you hit bingo yet. That pivots back to the lack of accessibility in our transit system. If our transit system isn't accessible, but your local hospitals won't take your healthcare, then how do you get to, say, East Harlem, which is the nearest hospital that will accept all Medicare and Medicaid plans? What are you doing? So it's really about making sure that we have the legal mechanisms in place that mandate. Some of this, again, will need to be done federally, but we can start it here by having conversations with hospitals, negotiating with them, and also working with partners in the unions, because unions represent so many workers there as well, and it's personal to them and their families also. So saying, you have your union healthcare, but think about someone that doesn't. Could they come to your hospital right now? Could your grandmother come? Could your cousin come? Could your mom come? Could your dad come if they don't have their own private healthcare plan? So being sure, again, that they continue taking Medicare and Medicaid. And then on to all arts and culture. It's New York City. I already spoke about Create NYC, which helps link disabled New Yorkers with jobs in the arts and cultural areas here. But we have some really great museums and other venues. And right now there's no voucher, no discount, no nothing for disabled New Yorkers or their aides that come with them. So it's about setting up a program akin to what veterans, students, seniors get. So disabled New Yorkers can go to our cultural institutions. Also, it's about fostering accessibility there that's not just physical. Some of the older buildings, it's difficult to get into. They had to go to the drawing board, the Met, for example, on which entrance they're going to use for accessibility, because there's the large flights of stairs, for example, at the Museum of Natural History, at the Metropolitan Museum of Art, and they've worked through the physical access to the space, but it's so much more than that. It's about ASL, it's about empowering blind New Yorkers, it's being sure that there are other services there to foster a true sense of inclusion. Once you're in the museum, once you're in the theater, once you're anywhere within a cultural institution, because that's one of the things that makes us such a vibrant city, our cultural institutions. And to think millions of New Yorkers right now can't get access to it because maybe physically they can't, inside they don't have the support services they need, or financially that it disenfranchises them from it. So setting up a program to have free or low cost for disabled New Yorkers and for their aides as well, that's on the policy platform. That's something I really want to do. Also, because it's the other side of my brain, I have a degree in art history. So making sure that we can get access to all of these museums is important to me in another way, because art's beautiful and everyone should be able to go and see it and enjoy. And then housing and economic development. So as I said before, I live in an inaccessible dwelling right now. So yes, the Americans with Disabilities Act, it's all new development needs to be fully accessible. Great. but there's still some small scale development happening in New York City that isn't fully accessible. For example, small walk-ups like I live in will maybe be bought, and they'll break down the unit number to make larger units where it'll be, say, maybe 2 apartments per floor instead of 4, but they're not putting an elevator in. It remains a walk-up building. What are we doing there? You're touching this aspect of the building. You can't grandfather in accessibility. We need to be doing full accessibility upgrades. Outside of that, also an inclusive design guideline. We need to have an entire plan that focuses on development being inclusive and accessible in every way, because again, accessibility isn't just about gaining that physical access. It's about more than that. So being sure our housing stock layers on the other forms of accessibility and inclusion, again, for deaf New Yorkers, for blind or low vision New Yorkers, being sure that all of our housing, no matter how big, how small, includes it. And then also the affordability levels. So many disabled New Yorkers can't afford the market rate luxury apartments that are fully accessible. It's older buildings like I live in that we can afford, but they're inaccessible, and that disenfranchises us. So making sure all new development is very much so targeted at affordability levels that disabled New Yorkers can afford. And then moving on to education. So we will be having some changes to education platform to include more higher education. But to start, we need to empower our District 75 schools. District 75 is where disabled students are put, but there aren't a robust school network where students will have to travel up to 2 hours. Right now, the Department of Education is being sued because students from Staten Island have to travel 2 hours to get to a District 75 school. That's not access to education. That is separate and largely unequal for these New Yorkers. And we need to be sure that we're expanding District 75 schools so there's one school in every community district that students can get to. We also need to change our justice practices. We cannot be having carceral style punishments for disabled students. Data shows that disabled students face higher rates of suspension and detention and use of restraints. There's a great New York Times article from 2012 that speaks about this. So moving away from those carceral practices, which also pivots to the school to prison pipeline, which impacts policing, and we'll get to at the end. Next, community-based and social services. So this is, you all can probably assume it's about getting the support services we need for housing, for food, for healthcare, for home care. As I said earlier on around COVID-19, we need to be sure that we're increasing outreach, we're increasing education, so everyone knows all of the avenues open to them. And for me, also a part of this is creating an agency that solely is responsible for accessibility, for inclusion, and for disability justice here in the city of New York. Right now, it's left to individual agencies, and that's why we see so many gaps in service. So being sure that we have one central place that will oversee all of this and ensure that we have accessibility in every area, we have the support services we need, and also everything from public meetings have ASL interpretation, because right now, if you go and testify at City Hall, there's no ASL interpretation. There's nothing if you are a blind New Yorker there. There's nothing at City Hall. There's nothing at the community board meetings I sit in. There is nothing at all. So being sure that all of our public meetings are fully accessible, that's so important as well. And now I'm going to move on to public safety, and then we'll close it out with small businesses. And then I'd love to take some of your questions before 9 p.m. So for policing, this is what I'm actually going to be putting out a separate disability justice platform on, because disability issues with policing are so rampant. The NYPD has actually been sued for how they treat disabled New Yorkers in moments of arrest. Everything from someone that needs to use their hands to sign, handcuffing them behind the back. There was actually a woman that came to a protest I helped organize and facilitate for 8 months, saying, I come to this protest because you make sure that there's ASL interpretation, you use an accessible route, and I know here I'll have someone to speak up for me if the cops handcuff me behind my back, because it's happened to me before, and then I'm told afterwards the taunts that they were using against me. Oh, you're stupid. Oh, why can't you this? Why can't you that? And that is not how anyone should be treated. And we know the policing issues largely outside of this. We need a whole lot of change. I want to completely reimagine public safety. I want to eliminate the NYPD and put forth another agency, another kind of community-centered model that fosters public safety and empowers people with the socioeconomic support they need. But to start, we need to work with the system we have. We need to increase education for the NYPD. We need to be sure that the Civilian Complaint Review Board also takes into account accessibility issues, that if there's a complaint around treatment for a disabled New Yorker with an officer, that's something that should go to the Civilian Complaint Review Board as well. And then finally, small businesses. So our small businesses here in New York are eligible for so many grants and tax abatements, but they just don't know that they're there. And for me, for a long time here in the community, there were so many stores that had one stair and people say, oh, Rebecca, you just can't do that one stair. And that would bother me so much. That stair is a huge, huge barrier. And that business can get $5,000 at the minimum from the city to upgrade their space and make it fully accessible. But so many people just don't know. And now where so many small businesses are struggling, they're like, I can't afford it. How do I pay my staff? I really want to, I want to help you. I want to get access, but like, it's just not financially doable right now. And that pivots back to saying my life and my patronage isn't worth the update. But you know what? Let's increase education. Let's let them know there are these programs, there are grants, there are tax abatements to help you bring more people from the community in and open up your space to be more inclusive. And now with that, I know I just threw a whole bunch at everyone, a whole bunch. Sarah and Tori are like, whew, she said it all. We have nothing left to say. But with that, I'd love to open it up to some questions. I tried to speed through the platform a bit, so there are some bullet points I didn't mention. I was trying to hit the top parts, but absolutely read it online. If you have any ideas to make it better, email me, rebecca@rebeccalamorte.com. This is a collaborative process. And with that, let's take some questions. I'm excited to hear.
Awesome. That was fantastic. Thank you. No one is shocked. That was great. So we have some questions that folks asked ahead of time that we are going to ask, and then we will open it up. So just a reminder for opening up, if you could type stack in the chat and then message your question to Caspian. If that is not accessible to you, feel free to unmute and either say stack or say you have a question or something along those lines, and we'll make sure that we get your question. So to start with, Rebecca, could you talk about how we get the state and federal government to make these points reality?
It's going to take a lot of work. I'm not here to lie to you, but for me, it starts with organizing. It starts with getting people together, building that base of support, reaching out to our elected officials, finding elected officials that are going to introduce legislation, and then following through on the lobbying side, working with me at the council to be sure that we have a strong bully pulpit. We have bills actively moving through the process. It won't be easy, especially at the federal level. It's like watching paint dry down there. It's very slow, but all together, if we're fighting and we're there consistently before them, I can tell you from my experience as a lobbyist on behalf of union members that change is possible. It may take a few years, but change is absolutely possible. For example, just last year, I helped pass a law that had been in the works for 30 years. It had been introduced for 30 years in a row, and I made it a reality. So that lets you know the level of commitment, the level of organizing, and what's possible when everyone works together and all of our voices are raised in unison. So it's really about organizing to start.
Awesome. And my cat came for the next question.
Oh, I need the feline support.
Yes, her name is Mao. She's a black and white cat. So the next question is, in a time of austerity, how can we persuasively make the argument that every subway station should be made accessible?
To me, it's about illustrating again how intersectional, bingo, how intersectional the issue is. And also it's about bringing revenue to the state. I reject the notion of austerity budgets. Austerity budgets hurt working class New Yorkers, hurt disabled New Yorkers, hurt seniors, hurt working families. And that's not the business I'm in. The business I'm in is increasing taxes on millionaires and billionaires, legalizing and taxing adult use cannabis, passing bills like a stock transfer tax, passing bills like legalizing sports betting to bring revenue to the state, and then have that money specifically earmarked for accessibility updates with legal ramifications if the MTA is not meeting these goals in a certain amount of time. I'm talking like, oh, you want to go and revamp this subway station? Well, guess what? You didn't finish with the 68th Street elevator, so we're not releasing those funds to you yet. I'm not afraid to play hardball. So when people come to me and say, oh, it's too much money, oh, it's going to ruin the streetscape, which people in the community have literally said around an elevator going in at 68th Street for the 6th train there, that it's a non-starter for me. And we need to bring new revenue to the state. We need to specifically earmark that money. And then we need to have strong enforcement mechanisms on the other side to hold the MTA's feet to the fire, because we know they're never going to do it on their own unless we demand it.
Thank you. Could you also talk some about your plan on working with the mayor's office for people with disabilities?
Absolutely. So the mayor's office has a great office set up. It's called the Mayor's Office of Disabilities, but they don't have the funding or oversight power that they need. So they're just more of a policy office where they can put forth ideas, they can put forth different policies for disabled New Yorkers, but they don't have the power to put it into existence. They don't have the power of oversight to hold entities, to hold agencies, to hold anyone accountable, quite honestly. So we need to take this agency out, we need to take this office out of just the mayor's office and make it the full agency that I was speaking about earlier, that we need to be sure we have one entire agency dedicated exclusively to the needs of disabled New Yorkers. And it starts with building from the mayor's office for people with disabilities, seeing what they've done, that it's worked well, seeing areas they haven't been able to move on because they haven't had the powers to, and giving that power to this agency.
Awesome. Thank you. And the next question is, how are you going to fight for digital accessibility for COVID-19 vaccinations and within public health communications on social media in general?
Absolutely. So it's something that also we at Rebecca for New York are improving on as well. So this things like alt text for images, the city doesn't do that. Things like having support staff for people to help you schedule that vaccine if you can't use the computer, if you can't use an iPad, if you're not able to access the digital realm in that way, that the city should have a mechanism for you, be it a phone number to call, be it someone to come to your door with an iPad to say, I'm here to set you up to get a vaccine. Let's protect you. Let's save your life. So that's what it's about to me. It's not easy, but it's something that we can absolutely do through also expanding Wi-Fi access. That's something too that to me is a part of this digital conversation for accessibility, because there are some disabled New Yorkers that you're going to make that choice. Do I pay rent? Do I go to the doctor? Do I get the medication I need? Do I have Wi-Fi? And if it were me, Wi-Fi would be the last thing I had. So being sure that we also increase broadband service is a part of this as well.
Thank you. We also wanted to ask about how do we get stronger protections under the ACA or under the ADA? I talk about healthcare a lot, so the ACA is the first one that comes out. Under the ADA for invisible disabilities in the workplace, especially for folks who aren't in a union.
Absolutely. So I'm blessed that my union does everything they can to make my job as accessible and comfortable for me, even down to giving me a car to use, paying for cabs when I'm not physically able to get on the train. But not everyone has that, like you're saying, Tori. Not everyone has that job. Not everyone has an employer that's going to take the time to listen to you and meet your needs for where they're at right now. And for me, it starts with enforcing HR departments to put forth an accessibility and inclusion and a disability justice plan. Every company should have one. What are you doing now? What are you going to be doing for the future? What's your representation like also for hiring from disabled New Yorkers? Because it's not enough to say, oh, we have a plan, but then there's not one disabled New Yorker in your office. It's like representation. It's not enough to say, yeah, we want diversity, we want hiring goals, but then you're not hiring Black New Yorkers, you're not hiring Latino New Yorkers, you're not hiring senior New Yorkers. So it's not enough to say it, but we need to have mechanisms in place, and we need to have measures to be sure that they have a plan and that they're enforcing it on the other side and they're meeting these goals, because it's not enough to say, let's do it, if you're not going to actually do it on the other side.
Awesome. So, this one is more of a comment. Um, someone's wondering if you've heard from other disabled New Yorkers about the changes to the streetscapes that have happened since COVID with all of like the outdoor dining and stuff like that. I know like a lot of us have friends who have been impacted by this. And yeah, is there anything that you would do about that?
Yes. So outdoor dining. So when they take the public sidewalk space, it makes it too tiny for most wheelchair users to go through. And even me with a cane, sometimes I'm like tucking myself in little tiny, trying to use this little tiny path between either a tree pit, the outdoor dining, there's a bike lane. You're not going to go in a bike lane. That's not safe. I've been hit by a bike as a disabled New Yorker. That's a completely separate story. But so a part of open streets, a part of outdoor dining, because we are going to be allowing it to maintain here in New York, we need to have a policy in place for the street coverage. We need to say you need to have X amount of feet for public egress Right now, the city has it. If you want to put in a tree pit, which are those little plantings on the street where there's a tree and some flowers, there's a certain foot radius that you need to have for pedestrians and New Yorkers to be able to access the sidewalk. And that's not being honored right now for the open streets and for the outdoor dining. The city said, well, we need to support small businesses. But again, we can do both at the same time. You can have outdoor dining and you can have access to your streets as well and not be forced to either stay at home or be out in the street, putting your life at risk for safety for motorists and cyclists and others.
Awesome, thank you. So those were our preset questions. So the pre-sent questions. So we're going to move into answering some of the questions that came through on Stack. So one of the first questions is kind of more about some of the tangible things you can do as a city council member specifically.
Tangible, so we can start by increasing access in our public meetings. We can start by making sure that every city hall public hearing, every community board meeting, every public meeting of any size, any scope, anything, any place has ASL, has captions, has the support that's needed. That's so many things even outside of that, but the city just doesn't have that mechanism right now. There is no mandate, and there's no mandate even for community board meetings, which is your most hyper-local form of government. And so many people turn out to, where for the first time with COVID, having them be on Zoom, it's increased accessibility for so many people that wouldn't have been able to attend these meetings before because they wouldn't have the support services they need, but they can set up things on their own private side for it. So we can start by that, being sure that all of our public domains are fully accessible. We can start by making sure things like every park and every library is fully accessible because the city has the money to do that. Right now, there are parks and libraries in the 5th district that aren't accessible. They're just not. So we can start in really tangible ways like that, and also tangible ways that aren't necessarily where you see the immediate return on investment, but that there's a policy getting to that long-term investment. So it's like the inclusive design plan that I want to see for development. It's like a resiliency plan for how to safely evacuate and empower disabled New Yorkers in the event of another Hurricane Sandy superstorm. So it's not tangible that you're seeing it and you're receiving it in the moment, but you know it's there for God forbid that moment happens, or you know it's there for when that development happens. So there are a few tangible areas we can start while we work on the much larger issues of the subway accessibility and the housing stock and also education. We can start with some changes to education as well by making sure that we have the schools, we have the funding we need. And that can come from Albany. There's this great thing called foundation aid, which is billions of dollars that Governor Cuomo just won't release here in New York. And think about all of that money for disabled students and all of the empowerment they could get. So those are a few tangible ways we can start.
Awesome, thank you. So this question, I really like this one. How are you going to empower disabled students who face the weight of ableism on our college campuses that limit the ability of disabled college students to thrive and kind of connect with our people and even just do well in school?
Yeah, the first thing, honestly, that comes to mind is how inaccessible NYU is as a campus. That's one of our large institutions here in New York, and most of their buildings are inaccessible. Even the Kimmel Library isn't fully accessible. So think, if your library isn't accessible when you're in school, what are you doing? That's a really egregious example of the lack of access and how it impacts students. And also outside of that, it gets back to the inclusiveness that we spoke about with the HR plan. Do schools have a disability justice and access and inclusion overarching plan? Do they have a policy? What are their plans for it? What are they already doing? And I know the answer, they don't. And that's something that we need to be implementing, because if you don't have that, you're not thinking about it at all. But like I said before, it's not just about having the plan, it's then making sure that these updates happen, that the inclusion happens, the access happens. And here for private institutions, at least, again, I'll use NYU as an example. They always come to the city saying, hey, we need the zoning change. Hey, can we get this public tax abatement? Hey, can we get some public tax dollars to help build with this? And for me, you're not getting any of that stuff if you're not inclusive, if you're not accessible. You're not getting any zoning variances to increase the footprint of your campus size if what you already have is not accessible. Why would I give you more to reward bad behavior when you're already not fixing what you have and innovating and revolutionizing what you have for disabled students? And also individually in the classrooms, there's there's so many things. There's so many things. I wish we had like 2 more hours to talk about all of this, because yeah, it's even in the classrooms, with learning and making sure that we have the support services for interpretation and even like remote learning. Again, it's not just for workforce needs, but being sure we're empowering students that way, where maybe you can't be in the class, but you can be zooming in, you can be listening in, you can find a way that makes it work. So we can touch on a number of areas.
Definitely. So one question is about, with the MTA being so resistant to accessibility to the point where they've faced 3 lawsuits instead of providing accessibility, kind of how do we convince the state and the MTA to enact real change?
To enact real change, for me, it starts by not allowing them to move forward on other projects and not allow them to raid these funds that are earmarked specifically for accessibility updates. A lot of what's happened at the MTA is they'll have money specifically marked for certain work, for certain updates, and then the governor has allowed them to go pilfer that and use it for other things. So it isn't going to be easy, I won't lie to you. And again, it pivots back to organizing. We need to create a bully pulpit. We need to have a group of people out there fighting every day, letting them know that we're not going to forget, we're not going to look away. And also elevating the conversation, honestly. I know it sounds very tongue-in-cheek, but the more we elevate the conversation of disability justice, the more we're speaking about it, not just from disabled New Yorkers. I actually had this conversation with a council candidate in Queens that reached out to me after we put out this platform. And they said, what do we do? And I said, you as an able-bodied New Yorker, you need to talk about the importance of disability justice, because it's just like racial justice. When we end white silence because that's violence, that's a part of bringing about the change. You need to speak up, you need to speak out. So you as an able-bodied New Yorker, be about this human rights issue, speak up, speak out, say it may not affect me, but it affects my neighbors, it affects my constituents, and this is why we need to be fighting. So elevating that conversation to a level where the MTA won't be able to silence the noise, because they have, I'm going to use a very reprehensible phrase, they have fuck you money. And we need to let them know that we have the fuck you power behind us, and we're going to be out there every day demanding this change. I apologize for cursing if there's anyone offended.
That was awesome. And I think this brings us to our last question. In what ways would you expand home health care with your platform?
Well, first we need to ensure that there's wage parity for home health care, because right now it's really an industry that it fosters indentured servitude for the workforce, which is largely undocumented New Yorkers, Black and brown women. So first we need to be sure that we are supporting strong wages for them. And then also we need to increase the support services, CDPAP, some great programs like that that allow family members to become your caregivers, that allow loved ones, friends to take that on for you. Because also that's a much more sense of personal care. Instead of having someone else care for you, it's the person closest to you. And so many families make the difficult decision of, I'll stop working, I'll do this, I'll do that, to take on family medical care or support a family member that needs help. And that just puts the entire family at a disadvantage. So we need to be expanding things like CDPAP. We need to be putting forth more agendas, honestly, around working with the union 1199 that represents a lot of these home care workers, and be sure that we have a work style that supports the workforce needs, but more importantly, supports the needs of disabled New Yorkers, because it's not just someone coming into your home to help you. You have a very personal relationship with this person, and we need to be sure that the state's there as well in that aspect.
Awesome. Thank you so much, Rebecca. Also, thank you everyone for coming, and I'll give you, of course, Rebecca, the opportunity to say the last word.
Oh, well, thank you so much. Again, I need to thank Sarah. I need to thank Tori, everyone that worked with me on the platform. I need to give some special shout outs to Caspian Brock, who's been running our Zoom, doing an amazing job, coordinating all the rooms and everything. Thank you so much, Caspian. I need to thank Bella, who's doing our live tweeting right now and made a lot of the really great graphics that you saw leading up to today that we were putting out. And I need to thank Harry Walton, our campaign manager, who helped spearhead this and bring so many voices to the table for me that I wouldn't have been able to know or meet or just be able to pull in so quickly with such great buy-in if it weren't for him and everyone on the team. So thank you so much. Also, I need to shout shout out Renee and Elise, our amazing ASL interpreters. Thank you so much for being here to support the needs of deaf New Yorkers and be sure we have this access included. This was so great. I was looking forward to tonight. I was obviously nervous about tonight, but I was nervous in a good way because I put so much work into this and I knew how important it was to me. And I was looking forward to all of your feedback. So I'm not saying this to be flippant. I mean it very seriously. If you have ideas, if you have things to add to the platform to make it better, things to take out, Rebecca, you're completely wrong. I'm totally open. I'm totally open. Sarah and Tori can probably confirm that for you. I am very collaborative. So don't hesitate